Now that we've all gathered for Thanksgiving, doctors are bracing for the germ spread from that gathering. The last 2 years brought waves of new COVID-19 cases around the holidays. Now it's not just COVID, but surging RSV and flu. Joining me now is MSNBC medical contributor Dr. Kavita Patel. I know everybody in my household, every single one of them, is filled with snot or coughing. They're just all a mess. So it's going to hit me, I know, again. But what should I be looking out for? What should parents like me, families like me be looking out for as those sniffles and coughs perhaps start to get worse?
Katie, I'm only laughing because we're sharing the same household. And actually, my 5-year-old is just recovering from literally weeks of RSV and that's what I want to tell parents to watch out for. This is something that certainly younger children, but really children of any age and also older adults can have really detrimental effects. In fact, older adults and young children, those are the most vulnerable groups for RSV to land in the hospital. Just, Katie, it's common sense as a parent. If you see your child struggling to eat, struggling to breathe, using their stomach or neck muscles to breathe, that is an urgent call to get to your local pediatrician or an emergency room. But be warned, the wait in most emergency rooms for children around the country are at a record peak, the most we've seen in about 15 years. So be patient, or at least have a plan in place for where you'll go and what you'll do if in case you need to wait for hours there.
Well, explain that to me, because if I'm going to an ER, it's because I don't have any more patients. It's because I'm terrified for my kid who can't breathe. How do you let a kid, how does it work if you get there and there's a line and they can't be seen immediately?
Yeah, so here's what, in every ER, including the ones I've worked in, we triage patients. So what we try to do is, there is no mother that's going to come in or a parent that'll come in with a child that can't breathe that won't be immediately assessed. What I mean by being patient is that it can be a long wait. You'll be in a room, most likely in a hallway, in a bed, having oxygen access, getting vital signs checked. But if you need to get to a hospital bed, an ICU bed, that could be the testing of your real time, because that's going to take, some hospitals are so over capacity, they're flying people out of state if they really need those intensive services. And so parents, I think, just, none of us want to expect the unexpected, but in this scenario, have a plan. And have a plan if you have other children in place so that you can have someone that can take care of your other children while you're tending to a child's needs. But let's hopefully not get there. I think the best thing that we can do is, households like yours and mine, we just try to limit our contact with other people. That means making decisions about going back to school, going back to work, and that's going to be hard for some families.
Is there a way to, if the kid starts coughing or starts showing signs of getting sicker, is there a way to limit it so it doesn't develop into RSV?
Yeah, it most likely, by the time they've kind of presented with those symptoms, they've already got the infection, much like what you're probably seeing in your own household. But you can do things that can support the child so that hopefully it doesn't get worse. Humidifiers actually do help in this scenario. So humidifying the room and having the child be able to just breathe a little bit more humid air. And then talking, of course, to your pediatrician or care provider about what medications, but sometimes supportive medicine like Tylenol and ibuprofen, children's doses, of course, and only if that's something that you've been comfortable with, that can also help just for that pain that most children are having when they're coughing and they're just kind of miserable. And then I did this with my daughter. I turned that hot shower on and I sat there with her, reminded of when she was a baby and had something similar. They just need to feel a little bit of relief, especially if you're in a dry, cold area in the country and it just feels cold outside.